With up to 90% of cardiovascular diseases being preventable and still the main cause of death in the United States and in Europe, Europe is moving forward toward the health of their entire population instead of just focusing on individuals at high risk. So what do you think about this approach?
It's huge and right. I mean, you really want to wait until the horse is out of the barn and somebody has a heart attack or a stroke and then start your treatment? Or do you want to prevent it by trying to pass legislation and to inspire people about what they can do to try and prevent this from happening in the first place? So what we're really looking at is more general things to do. Encourage people to do certain things like exercise on a regular basis and eat food that's healthy, and maybe pass some laws that will prevent the subsidization of foods that are bad for us, like high fructose corn syrup, and maybe subsidize.
Subsidizing the healthy foods and the organic foods and making them affordable.
Exactly. So if we did things like that, now you're talking about real prevention, where people can take responsibility themselves to do something that really makes a difference.
Yeah, and to clean up the environment too. I mean, we're surrounded by toxins. They're in us and on us and around us. They're like everywhere. We're in a sea of toxins. So that would be a really good start.
Well, they cause inflammation, those toxins. And inflammation is what poisons our cholesterol to make it do what it does to us. It raises our LDL cholesterols. It tends to make our blood sticky. It tends to make plaque form. And that's what causes the heart attacks and strokes. So you're exactly right.
Yeah, so the other thing too that I was thinking of is if we could get exercise back in the schools a little more, because they kind of took it out and put more emphasis on on
reading, writing, and arithmetic. They want to make more rocket scientists, but not necessarily rocket scientists that will be healthy or live a long time.
And maybe getting the junk food out of the schools and out of the stores that are close to the schools.
Exactly.
We need to prevent obesity in our children instead of talking about putting them on statins.
or doing something to treat them rather than look at the underlying cause.
And maybe have more footpaths and more sidewalks and places so people can walk and ride their bicycles more. And another suggestion that they made on this panel that they had was that they were talking about banning smoking and how to tax it and all that kind of thing that we've talked about here too. But I thought one of the things that was kind of neat was they said not to label the packs of the cigarettes. So like the only thing that would be on it would say that it was dangerous and nothing else.
Well, things like that can help, and they all kind of add up. The best way for change, however, is through education. So people are inspired and they want to live a healthy lifestyle. And so they'll choose the things that are good for them. Prohibition really didn't work. When we have this epidemic of drugs, street drugs, that's all over the place, it's worse when we make them illegal than when we try to just allow people to do what they're going to do and then try to help them once they get into trouble.
I guess it's sort of human nature to kind of want to get by with something.
Well, yeah, if you can't do it, then you want to do it. So we really need to evolve as a humanity so that we want to take care of ourselves. We've been hoodwinked by the pharmaceutical industry and the medical profession that's trying to convince us that we need them, we need that drug, we need that procedure, we need something that they do to help keep us healthy because we won't take responsibility ourselves.
And the way to keep healthy is about prevention. And again, to repeat over and over and over again, is a lifestyle, a healthy lifestyle, eating the right diet, getting enough exercise, stress reduction, getting enough sleep, and having a meaningful purpose in life.
I think you've got it down, Vicki. That's really good. So when we're talking about prevention of cardiovascular disease, yeah, it's good that we do something to start taking responsibility ourselves. Yes, we need to do as much as we can to change the law so it's more difficult for people to get products that are not healthy for us and to eliminate them from our environment. But it's really education. And if we do that, we'll see this epidemic of cardiovascular disease, of cancer, and this chronic diseases, it's an epidemic form. We'll see that disappear. And it won't just be 50% like they're predicting in Europe. It'll be more like 80 or 90%.